Ready? So, hello everybody. My name is Nishtha Sharma, and I intern at Memorial Hermann Hospital Southeast with Mr. Leandro Valdez, and my interest is in the medical field. So, before internship, I felt very excited and eager to learn. I was ready to explore the medical field, and since this was my first internship, I was actually really looking forward to this exciting opportunity. And I also felt a little nervous before internship because I didn't know my mentor that well. I didn't know the ER staff that well, and I also didn't know what I'm going to be doing in the ER, so I felt really nervous because of that. And my first day on site totally changed everything because I went to Memorial Hermann and I saw my mentor, and he was really, really nice, and he told me to follow him around wherever he goes and to not hesitate to ask any questions. So I was really excited that my mentor was really nice, and I felt comfortable with him too. And on the first day, I saw many patients in the super track of the ER. Some of the patients that I saw are listed here. My first patient that I saw had severe pain in their arm, and my mentor did a physical examination on the patient, and he said that, you just continue with ibuprofen. And my mentor was explaining to the patient, what could have caused this, and while he was explaining to the patient, he answered many of my questions too that were popping up in my head. The second patient was the patient that made me choose my project for this internship, because the patient had a concussion by a sports injury, and my mentor, again, he was explaining the patient's family about concussions and how to treat them and how it occurs and what could have happened inside the brain. My mentor, he decided to not give the patient a CT scan because the patient was really young, and my mentor based his conclusion off of the PRECON method, which is a Pediatric Emergency Care Applied Research Network, and this method is designed to reduce the chances of cancer whenever you get older, because CT scan, x-rays, they have high dose of radiation, and this can accumulate in your lifetime. And eventually, you might come back for another x-ray after a CT scan, and etc. So this can, your radiation, the amount of radiation in your body can accumulate, and this can cause cancer later on in your life. So this method is designed to decrease that by going on this method, which can basically confirm your results and conclusions. And so you don't have to do a CT scan to a patient or any other. The third patient was really interesting because the third patient broke their finger, and their tip of their finger was dangling, and there was blood coming out. So I felt really happy because on TV shows, the ER is usually blood everywhere and stuff. So this was kind of my first sight of blood in the ER, and I was just, it was pretty cool for me because I never really got to see something like that. And it was preparing me for the medical world of surgery, so that's why it was a really interesting patient. And my mentor, he put anesthesia on the finger, and he numbed it, and then he put multiple stitches on the finger. So, yeah. Typical day while I'm on site is usually really simple because I follow my mentor in the ER, and I shadow him in the ER. And my main contribution to the site, I don't really contribute much to the site because I don't have to do anything in the ER since I can't do anything in the ER. But sometimes I help my mentor by holding his official documents or clipboards or paperwork whenever he's examining the patient. And I also assist my mentor and the patients by quickly grabbing them a blanket, towel, or gown whenever they need it. So now I'm going to be discussing about my projects, which is on concussions and head injuries. So before I began my project, I did some background research on it so I can understand concussions and head injuries material better. And I did my background research on the brain. And I found out that the brain is a tissue, and it's cushioned by the spinal fluid, and it's protected by the skull. It has billions of neurons in it. And the largest part of the brain is the cerebrum, And other important parts of the brain include the cerebellum, corpus callosum, medulla oblongata, and thalamus, and etc. And we can compare the brain to a modern-day computer because it stores our memory, thoughts, and information. And the brain is also the center of the nervous system. And I researched, and with my research I found out that with evolution, the brain is becoming more and more complicated. So that was a really interesting fact about the brain. And I also did some research on the brain anatomy, and I found out that there are 4 lobes, the 4 important lobes of the brain, and it includes the occipital lobe, the temporal lobe, the parietal lobe, and the frontal lobe. So the occipital lobe is associated with visual processing, and the temporal lobe is associated with auditory perception and speech, and the parietal lobe is associated with movement, and the frontal lobe is associated with thinking, problem solving, and emotions. So we use the frontal lobe to think with. Now I'm going to be discussing the various types of head injuries. And there are actually a lot of head injuries, but these are some major head injuries. And there's trauma, and trauma can either be blunt or penetrating. So an example of a blunt trauma, it usually occurs in motor vehicle collisions or whenever people fall. And penetrating trauma happens whenever a bullet enters your body or a stab wound. And a stroke occurs when there is impaired blood flow, depriving oxygenated red blood cells to vital organs or tissues. So there are actually 2 types of stroke. There's an embolic stroke versus an arterial stroke. And the embolic stroke usually happens whenever there's a blood clot. And there are various types of embolic strokes too. There is the fat emboli, which is common in long bone fractures. And there is the air emboli, which can occur to scuba divers and during scuba diving. And the amniotic emboli happens during childbirth. And drugs can also harm the brain in a very dangerous way. For example, Michael Jackson, he died because of the medication he was taking. His medication suppressed respiration and caused decreased level of oxygen, which eventually led to the cellular death of his tissues, including the brain and heart. And basically, opiates and prescription drugs like pain medication and illegal drugs like heroin can also impact the brain the same way whenever it's abused. Also, other drugs like cocaine and amphetamines, they stimulate neurons to release an abnormally high amount of neurotransmitters, which can raise blood pressure, and it can cause the arteries to rupture, and it can cause decreased blood flow, and then cellular death can occur of the tissues. And neurotransmitters, they also alter people's moods. So, for example, ecstasy, it affects a neurotransmitter called serotonin, and this makes people have chronic depression. And lead paint, it can also prevent cellular function, and I'm sure everybody knows the negative effects of alcohol, but alcohol is a depressant, and it can impair the brain and respiratory drive. And I'm going to be talking about concussions more on my next slide. So I had this video for concussions, but it's not working right now. But this video was a visual way of seeing how concussions actually happen. So basically you have the skull, and the brain's inside there, and in between the brain and the skull is the spinal fluid. So whenever a concussion happens, you get a blow to your head or something like that, your brain kind of moves inside the skull, and that's how it can get damaged by the skull. So people sometimes wear helmets, in sports, to protect that, but even then, concussions can still happen.
So you're saying that is it floating? Your brain is kind of floating?
Yes, it's floating in the spinal fluid. So that's why whenever your brain, you get a blow to your head, then your brain, it just moves inside the skull because it's protected by the skull. So that's how a concussion can occur. So what are concussions? A concussions is traumatic brain injury which can alter the way your brain functions. And effects are usually temporary, but they can include problems with your concentration, headaches, balance, memory, coordination. And concussions, they're usually caused, again, by a blow to the head, and they damage brain cells. So you need like a lot of rest and time to heal your brain. And concussions are common if you play a contact sport, such as soccer, football, lacrosse, rugby. All these sports are kind of dangerous for your brain, so you have to be very careful. And again, just like I said, this injury needs a lot of time to heal and rest properly. Most concussions are really mild, and people recover real quickly. So, I developed 2 hypothetical cases, and I'm going to be treating both of my hypothetical patients. So my first patient was a 60-year-old man, and he was going downstairs to get an afternoon snack, and he tripped and fell. And he had a concussion because whenever he came into the ER, his symptoms were he had headache, and he had pressure in his head. He also had ringing in his ears. He also had a loss of consciousness for more than a minute, and he has difficulty with physical coordination, and his symptoms were becoming worse. So for my treatment, I performed a physical exam to check the nervous system, and based on the results of the physical exam, I will perform a head CT scan. And the CT scan came back fine, and there's no internal bleeding or skull fracture in the brain. So I will discharge my patient by giving him pain medication for his headache and request him to rest. I will also tell him to follow up with his primary care physician, because his primary care physician may request like additional testing to see if a certain brain part or there's more damage to the brain. For my second case, there was a 16-year-old girl, and she was wrestling in her school competition, and she got a blow to her head. So her symptoms in the ER, she had throbbing headache, she was dizzy, and she had slurred speech. She was sensitive to light. She also had loss of consciousness for more than 3 minutes, and she had difficulty with her physical coordination and balance. Her symptoms were also becoming worse. So for the treatment, I will perform a physical exam to check her nervous system again. And yes, I will recommend this patient for a CT scan, even though she is young, but there are 2 reasons why I will recommend her for a CT scan. It's because she had slurred speech, and she had loss of consciousness for 3 minutes. My mentor explained to me that these are really big like red flags that you need a CT scan to see what's going on inside the brain. So this CT scan came back fine, and there was no internal bleeding, and there was no skull fracture, and the types of bleeding, there could be a subdural bleeding or epidural bleeding or subarachnoid bleeding. So there was no type of internal bleeding. And I will discharge my patient again by giving her pain medication for her headache, and I will request her to rest. But I will also request her to not watch TV or take time tests, because this will actually not heal her brain properly, because it'll just take a lot more time for her to heal her brain. So I'll refer my patient to the Ironman Sports Medicine Institute at Memorial Hermann for concussion program. This program is designed to help patients that had concussions, and it's really good because it explains the patient's family and the patient what type of concussion they had and how they need to heal it. Some alterations to the site that I could make is I would like if the doctors and the nurses could have simple organized charts on computers, so it would make the nurses and doctors' life a lot easier. Because I don't know, I have a feeling that it takes time away from them taking care of a patient. So I prefer if they have simple, organized charts. And I know that it's important to document all the patient's information, so I really prefer if they have simple charts. I would also like to have people to clean the patient's room, like specific people, because right now in the ER, volunteers, they clean the patient's room, But whenever the volunteers are not there, the technicians have to clean the patient's room. And I have a feeling that, again, it takes away time from the technicians doing their job. They have to clean the patient's room, and then they can get back to their job of what they're doing, taking care of the patient. I also think that my site, my presence at the site enables others to, it just informs other people that students at Clear Horizons are really eager to explore their medical field and experience their future careers. And I think my presence might make the nurses and doctors work a little bit proficiently and efficiently. The most frustrating thing about being on site is that it's really hard for me to watch the patient sitting and waiting for their answers, because sometimes it could be like a matter of life and death, and they're always really concerned about their loved ones, like their wife, their child, their husband, and it's so hard for me to just see them wait for their answers. And also, I think the time that it takes the lab to complete a test, because before my mentor can make any step, move on forward to decide what's going on with this patient, he has to have the lab results back to see if he could confirm his results. And I believe that if the lab can finish their testing quickly, then it could make the processing the ER work faster. Also, I think everybody knows this too, I ask a lot of questions, and I have a feeling that I get in the way of my mentor by asking a bunch of questions, because I'm distracting him from his job, and I'm also I'm in the way of him saving the patient's life. But my mentor, he does a great job of giving me the time to ask questions, and he answers all my questions. He always sits down and he's like, okay, do you have any questions now? And then I ramble on with my questions, and he just gives me a lot of time, so I really appreciate that. The best thing about being on site is that I get to learn about a variety of disorders and problems. And because the ER is just it's filled with a bunch of disorders and people that can come in, so I get to learn a lot about all these disorders and problems. I also get to see real human blood, because this is another good thing, because it's preparing me for the medical world of surgeries. If I want to pursue my career and go into the surgical field, I think just this is a little start. So I think it's going to prepare me eventually to get used to the sight of blood. And I also enjoy learning a lot about ectopic pregnancy cases. So whenever ectopic pregnancy cases come in, I really like talking it out with my mentor, what's going on and how he's going to deal with it, and what's his step and which pathway he's going to choose. So I really enjoy learning about ectopic pregnancy cases. I'm really proud about not fainting and controlling myself, because there was this one incident where one of my mentor students was stitching a flap of skin, and I was like, okay, I'm gonna watch this. And I was watching it, and suddenly I didn't feel good, and I felt dizzy, and then I was like, okay, Nishtha, you have to take a step outside so you can feel better. So I came outside, and I felt better, and I calmed myself down. So I was really proud of myself for not fainting. I'm positively benefiting from being on site by, again, learning so much variety in the ER, because I think this is seriously making me strong for the future medical field. And again, I'm also learning about a variety of problems that human beings can have. And I'm also learning a lot of medical terminology and the gadgets, the tools and terms, because, for example, I learned what a banana bag is. And it's a IV bag which has nutrients and minerals for the patient. So small things like these, I'm learning so much in the ER, and I really enjoy that. So in conclusion, I would like to thank my mentor, Mr. Valdez, who's helping me experience my career in the ER. And the ER is giving me, again, it's just not focused on one particular field of medicine. It's everything. I learned about the heart, I learned about the brain, I learned about pregnancy cases, and there's just, it's so vast, it's so big, and I think it's a great place to start at for me. Since this was my first internship, I really enjoyed it. And as a volunteer, we were not really allowed to deal with patients. So I was really glad that, being an intern student, I could actually see the patients and see what's going on with them. And my mentor really helped me experience my medicine field. So I've learned a lot in the ER, and it's only been about 3 months of internship, and I'm really happy. So I would like to thank you, Mr. Valdez. And again, thanks to Mr. Valdez, Ms. Nyland, Ms. Graham, and Dr. Nadine Islam for helping me with my project and internship. I really appreciate it. Thank you so much.
Also to Dr. Lamley for all the
Yes,
big
Dr.
comment.
Lamley. And does anybody have any questions?
Yeah, I have some questions.
Oh,
It is said like brain is roughly like 80 or 90% water. Is it true?
It's yeah,
Yeah.
and because of the specific gravity of the cerebral spinal fluid, that's why the brain floats and acts like a shock absorber basically whenever you come to a sudden stop.
Right.
So it protects the brain initially, but then you can get what's called a counter-coup effect, and you get that bruising effect on the backside of the brain, and that's where we see a lot of these type of injuries.
Good.
any questions? No? Okay. Well, thank you. I'm so excited. Thank you so much.